As you grow up, there are a lot of challenges which used to come in earlier age, but today these challenges are coming to the young generation. 30, 25 people are also getting heart attacks, diabetes, and all these things. So, what is your advice to such patients or such type of population?
So as a doctor, we have to go with a holistic approach. That is very important. So in holistic approach, the first is health well-being starts from your home, You have to start doing your exercise time to time. You have to have a good health maintained. If there is any symptoms of any, you get checked with the physicians wherever you are, Don't go with just taking medicines and all. And regular health checkup, exercises, and to be strong from the mind, there is a saying, if you have a healthy mind, your body will be healthy, So that is, so you have to cope up with these stresses in this day-to-day life. Yeah, I believe these are the few tips they can do.
Welcome to HELLODOC. Today, the word is so much engraved into various types of diseases, problems, and everybody is running around doctors, medical colleges, nursing homes. But still, the people are not getting what they want. And that is why the medical fraternity has a very important role. So, ARYA PHARMALAB brings in this program what actually the doctors are going to offer to the common man. That is our motto in this program of HELLODOC. So, every week we will be coming out with one doctor who will be with whom we will be discussing on how he is going to serve the society. So with me today is Dr. Sandeep Gupta from Pokhara, Nepal. And sir, I just wanted to know from you first. We should was your journey, how you have started, then MBBS, MD, and now how your journey is going on.
Thank you, sir, for your question. I am Dr. Sandeep Gupta. I'm a physician working in Gandaki Medical College. I'm an associate professor. So the journey starts when you look back 20 years, 30 years back, So I come from eastern part of Nepal, um, in a family where I'm the first doctor, blessed to be the first doctor. We saw in the village, there were health practitioners, like we say CMA or HA, and one of the HA was a friend of my father. So I was very fascinated when he used to treat everybody in the village, He used to work in the government health post, and then mm, he used to treat other people's in the villages. Like in the villages, you have a bonding and taking care, and so that really made me excited. And my family also said you should study, and then if you can become a doctor. That was a big dream there. And in the challenges and hurdles and gradually, I completed my MBBS in 2005 from Nepal Medical College Teaching Hospital. And then I went to work again in the eastern part of Nepal in BPKHS for 1 year as a medical officer. And then I I was selected as a scholarship in the Institute of Medicine Teaching Hospital as a general practitioner. And then after that, I work in different parts of Nepal. I work in Palpa, Lamjung, and then now I'm finally working in Pokhara. So looking back, it has been very much exciting journey, and taking care of patients, helping people survive, treating, and more than that, that gives me a big satisfaction at present. But still, I say a long way to go, definitely. Um, Hoping something more new, and the new era of medicine can bring some new changes and help people live more longer. So recently, I did my fellowship degree from Christian Medical College, uh, Vellore, India. I did a geriatric course, feeling that now the statistics says that in Nepal, presently there is 10.1% of geriatric population out of 30 million population, which we have. And it is in the next 10 years to 20 years, they are saying it is going to double, So we need physicians who have more empathy, more compensated care for the geriatric people. So the journey is still going on, sir.
Yeah. Sir, exciting journey. But as you said, some of your father friend was looking into patients and you got inspired. But if you see, sir, at that time, basically geriatric patients were having problems. Today, the younger generation is having a lot of problems. So, how do you differentiate both the situations and how do you take it during your day to day clinical experience?
As a physician, we see people from all age group. To be honest, you get pediatric, you get young people, you get middle-aged people, you get the geriatric people. So, and each people have their own medical problem and diagnosis. But definitely, the young people are in the big dilemma now. In the big, uh, I don't say typically like a health crisis, but they have some undiagnosed medical problem or mental health problem. That is what is being faced by that. That is, there are different factors to that. If we try to talk on that, but you're right. Yeah, young people are having a lot of health issues and other things, but again, we have to have a balanced life for that. Uh, Work, and if they are engaging their work, they have to be focused on their work, and if they are engaged in some other business and also they have to, if they can cultivate a habit of doing that, and accepting the other um, non good things like smoking, alcohol and all, their health will be very good, I believe.
So, what advice you would like to give to the young generation so that they can be inspired with your life or with the life of Armenian persons?
No, again, there is different criteria for young people. Whom you say young, that is what we say. So uh, even I'm in 40s, I say I'm young. Okay, so but the basic young, like who is the most productive age group, is up to the age of 30. So they should be more working hard, more passionate towards their life, and they should have some goals which they can set, and in that way they will be targeted to that, and then they will live a very healthy life. Yeah, I believe that way.
Yeah, definitely, sir. Because at the end of the day, health is wealth, and everybody needs a healthy life. Even as you said, even today, 40 is also a younger age. But as you grow up, there are a lot of challenges which used to come in earlier age. But today, these challenges are coming to the young generation. 30, 25 people are also getting heart attacks, diabetes, and all these things. So, is your advice to such patients or such type of population?
So as a doctor, we have to go with the holistic approach. That is very important. So in holistic approach, the first is health well-being starts from your home. You have to start doing your exercise time to time. You have to have a good health maintained. If there is any symptoms of any, you get checked with the physicians wherever you are. Don't go with just taking medicines and all, and regular health checkup, exercises, and to be strong from the mind. There is a saying, if you have a healthy mind, your body will be healthy. So that is, so you have to cope up with these stresses in this day-to-day life. Yeah, I believe these are the few tips they can do, and along with that, not to do the bad habits. Yeah, so like food or alcohol or smoking and all, and then definitely they will live a healthy life, I believe.
Thank you, sir. Thanks for your inspiration. As you said, that healthy life is very important for every youth and it has to be kept. A healthy mind is also very important. So, thank you, sir. Thanks for this podcast. Thank you.
Thank you for giving this opportunity, ARYA Pharmaceuticals, and looking forward for more health broadcasts for our people all over the world and Nepal. Thank you.